The account I'll be focusing on is again the Kisii tribe of Kenya. But craniotomies have been documented again in many parts of Africa. Examples being the Korea people of Tanzania, the Venda people of Nigeria, the Baganda, the Ankole, and the Soga people of Uganda and Congo, and many other people. So Johns Hopkins defines a craniotomy as the surgical removal of part of the bone from the skull to expose the brain. That's basically what a craniotomy is. So in the Kisii language, the term that is used to describe a surgeon is omobari, but the term that is used to describe a surgeon who particularly specializes in craniotomies and many different types of head surgeries is omobari umutwe. Omobari meaning surgeon and umutwe meaning head. A random side note: the Kisii word for head is umutwe, and the language I grew up speaking, Bemba, the word for umutwe for head is also umutwe. There's a lot of through lines there, obviously, because all of us are Bantu people. Anyway, these Ababari would perform craniotomy on patients within the community who would be presenting with some sort of discomfort or mental issues stemming from traumatic injuries to the head, or some sort of long-standing issues like migraines and tension headaches and what have you. The surgery would usually be performed at the household of the patient, but sometimes the Omobari had a separate room on their properties that was dedicated to attending to patients' needs. So the following are excerpts from Dr. David W. Furness's 1986 paper on the traditional medical practices of the Kisii people, the same paper that I referred to earlier in the episode when I was talking about sequestrectomies. The Omobari would discuss indications, risks, and uncertainties with the family preoperative, and a decision would be made after considerable deliberation. The Omobari takes a history from the patient and family members, then examines the patient. As he pallates the skull, he decides the most likely site of injury and plans a corresponding site for the craniotomy. A final examination is made at the time of surgery when the head has been shaved. In acute injury, the goal of the surgery is to identify and remove fracture lines and bone fragments. Loose pieces of bone are removed and any visible fracture lines are smoothed off. One Omobari spoke of the need to remove bad blood when it was encountered. He said if darkness were noted under the dural layer, the thick, dense fibrous membrane that separates the skull from the brain, he would make a small opening and remove blood. Each Omobari made use of freshly prepared leaves, which were ground up in a large wooden mortar just before operation, and these would be packed into the wound for hemostasis. So hemostasis is defined by the National Institute of Health as the mechanism that leads to the cessation of bleeding from a blood vessel. So basically, these herbs would be prepared to pack into the wound to tamp down the bleeding and make it possible for the Omobari to see what he was doing when he would operate on people's skulls. The thick stem of banana leaf was twisted so that the watery sap bathed the wound during surgery to cool the wound, according to the Omobari. Dr. Furness also hypothesized that the juice served as a sterile irrigation solution. Ghee or fat from the tail of a ram was placed in the wound at the end of the operation. Other herbs were used in dressing changes post-operatively from plants in the nearby forest that were sun-dried and reconstituted with water when needed. In some cases, they were used along with modern medical interventions, like with one Omobari who would bathe the wound with half a vial of penicillin and inject the other half. While complications from the Awabari's medical interventions did occur, according to data compiled by Dr. David Furness, between 500 and 800 procedures are conducted by the Awabari, and only 3 fatalities were identified by Dr. Furness and company, putting the mortality between 0.6 and 0.375%. So in a case where traditional Kenyan healers are operating on people's heads in open air without a sterile theater, the fatality rate of those procedures that are being conducted by these traditional healers is less than 1%. That is absolutely amazing.